I'm Dr. Hollington. Today I'm going to talk about buprenorphine. Buprenorphine is a chemical also known as Suboxone or Subutex, which is used to treat addiction. Buprenorphine is an opioid. Like any other of many opioids, it attaches to the opioid receptor in the brain. Other examples of opioids are oxycodone, morphine, heroin, and fentanyl. All these medications affect the same portion of the brain. Buprenorphine is no different from them in respect to its mechanism of action, what it affects in the brain. Buprenorphine is an opioid. It is addictive, but it is used to treat addiction because it has some special properties that make it different from most of the other opioids. I'd like to take an aside here and say that what I'm going to talk about today is the state of the science as understood today, as I understand it. Now, I am clearly going to misstate some things, some of them just to simplify, some of them because, honestly, doctors don't know everything. We have theories about what we know, and we're just wrong sometimes. But I'm going to give you the best information I have. Okay, so in the brain, there's an opioid receptor. And every opioid floats around in the bloodstream and touches that receptor and opens it up for a second. Touches it, opens it up. Touches it, opens it up. If there's more opioids floating around in the bloodstream, it'll spend more time open. And so by taking any opioid, like heroin, for example, and if you get a higher dose in the bloodstream, you're going to spend more time with the opioid receptor open. A little bit more, 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 right up until you hit the dose that you die. So most opioids have a dose effect that increases and increases every time you take that opioid. This is not necessarily true of buprenorphine. Buprenorphine, and this is a numbers, a kinetics game that we talk about in biochemistry. But in theory, buprenorphine comes along and binds onto that receptor and opens it about a third to half the way. Okay? By binding the receptor, it makes it so that it changes a lot of things about the way that things work. First of all, the receptor likes to be bound, so it for the person taking the drug, it actually feels like they're actually well treated for pain and other things. But it also blocks other opioids that might be floating around in the bloodstream from reaching that receptor. So the receptor is now blocked. Other opioids are less effective, so it decreases the desire to have other opioids for a person who is taking buprenorphine to want to take other opioids. There is some leakage. I mean, some very powerful opioids can get around the buprenorphine bond, but they mostly don't. The next thing is that if you have, there's a dose effect. If you take 12 milligrams, for example, of buprenorphine, which is a fairly hearty dose, but not huge, you bind, in theory, 98% of your opioid receptors, which means that if you have 12 milligrams you've just taken, and you take another 4 or 8 milligrams of buprenorphine, you're not really going to feel it. They've only got 2% of the receptors that aren't covered. You're not really going to cover that much of them more. You're not really going to feel it. So this is a positive thing because for most opioid addicts, it's there's a constant desire to have more and more and more. But if you find out that in this particular case, with this particular drug, taking more doesn't increase your high, then you eventually learn that there's no reason to take more. You take your 12, you're done. There's no reason to take more because if you take more, it's just going to be wasted. Wait until the drug that you've taken wears off and then take your next dose. This gets people into the pattern of taking their doses in a timely fashion and fights the entire basic principles of addiction. One of the problems with addiction is that constant desire to have more and more and more, and your body develops tolerance, and then you are, more deeply in addiction. It costs you more money. And in the end, because of the tolerance, you're not really experiencing anything better than if you've just taken a lower dose. Buprenorphine fights that. It's effective. People who are on buprenorphine, people who are on regular opiates, like, for instance, oxycodone, there's a constant need to try to increase the dose because you take some and it works a little bit less every time, a little bit less, a little bit less, and you want to take more. With buprenorphine, that effect is much, much attenuated. In theory, you can stay on buprenorphine for a very long period of time, and your dose effect, it won't make it less and less effective. That's not exactly true. The first time you take buprenorphine, you get a fair amount of euphoria, but that euphoric feeling is pretty much wiped out during the first month of being on buprenorphine. You don't really get euphoria anymore. You do get reasonable pain control. Pain control is persistent, and it seems to be persistent for years. A lot of opiates, the pain control is gone after the first 7 days, 30 days, or certainly gone by 90 days. With buprenorphine, you do get a reasonable amount of pain control even after 90 days. Even I've seen people who take it and have complaints of arthritis, and the arthritic pain is decreased even after several years. So better pain control, less euphoria. And euphoria sounds like a good thing, but it's life disturbing. I mean, people act strangely when they're euphoric, and therefore they're not able to function. So the other things that opioids do are, nausea, constipation, and there are a great number of side effects. Buprenorphine has all of those. Taking buprenorphine is not going to get you away from the classic side effects of opioid treatment. But it will, for the most part, reduce addiction. I treat people who are addicts, and these are people who have a very hard time controlling their intake of Percocet or whatever they're addicted to. And when I put them on buprenorphine, the vast majority of them, over 90%, are able to stay at a level dose of buprenorphine for months at a time, which is not something they can achieve with other opioids. You can get high on buprenorphine. I said that earlier. I mean, usually not a long-term thing. You can't do it month after month. There are other medications that people use to try to increase this high. I mean, we're talking about people who are addicts here. They like that. This is really the reason they became addicts in the first place. So people do try to use buprenorphine to get high, but it's really not that effective. There is some concern, or there was some concern, that a lot of people were injecting it and using it to get a better high that way. The evidence has shown that it's not really that popular as an injectable. If you're going to inject, most people who are going to inject are going to get heroin. Heroin's cheaper anyway. It gives you a better high. Many of the people who are trying to be on buprenorphine are on buprenorphine realizing that it doesn't give them as good a high. They're not really there to get their high. They're really there to try to reintegrate to society and try to have something that takes care of their addiction needs, their dependence upon the opioids, without removing them from society by making them high. Some people have claimed that some have said that buprenorphine is not addictive. That is not true. Buprenorphine is very addictive. It's not as addictive in some ways as heroin, but in other ways it is more addictive than heroin. The opioid receptor really likes to be bound. So the binding effect that you get with buprenorphine is actually more addictive in some ways than the oxycodone typical non-bound effect. But because you have less of the receptor being open, it's less addictive in other ways. People who've tried to get off both kinds of medications, and there's a lot of them, have people who have tried to get off both of these medications have told me that it's a very different thing to get off one than it is to get off the other. And some people have said one is easier, some people said the other is easier. I don't think buprenorphine is any easier to get off of than any other opioid. But because you don't have that escalating effect where it's constantly pushing you to take more, you can gain ground on buprenorphine and over time get off of it. The other thing is you do have time because you're not chasing an addiction, you're treated and you are functional in society. Also, money is an issue because heroin is cheap right now. On the street of heroin, I'm told street heroin is very cheap right now, cheaper than it's ever been. But it doesn't matter because it doesn't last that long. So you end up buying heroin, every hour or every half hour to feed your habit, and then you escalate the doses, and it gets to be very expensive very quickly. Buprenorphine, you have to deal with talking to a doctor, but the actual cost of the medication is a known. We're talking about $150 a month, something like that, which is expensive, but you can easily spend that much in a day on heroin. And then, of course, the doctor's appointment is more money than that. My office, we try to keep the total cost under $150 a month if we can. We've been somewhat successful with that. There are strategies for reduction in buprenorphine intake. There are other medications we can give that will help decrease the side effects and help decrease the dose. There's patterns of timing or taking the medication, and those patterns can help you to get off of the buprenorphine. Ideally, we'd like to see people only on buprenorphine for 90 days, but realistically, an addiction that somebody has had for a longer period of time, these addictive tendencies run very deep, and some people have stayed on buprenorphine for years. Some for, I've seen 10 years. But obviously we try to help people get off the medication as soon as they can. That's one of our goals. So the points of this video then are, we talked about buprenorphine. It's a substitute for other opioids. It is addictive. It has properties that make it a better medication than most other opioids, because it leaves you functional, and it is less expensive. It also, we have strategies to help you get off of buprenorphine. You can take your time doing that. There's no rush. The last thing I'd like to point out is that if you're taking street meds, even if you're taking oxycodone, something that is usually a prescription that you've borrowed or stolen from somebody else, that oxycodone that's sold on the streets oftentimes can be adulterated with chemicals that are dangerous. And obviously heroin and fentanyl are frequently either at chaotic levels of concentration, so you don't know how much you're injecting, or they're contaminated with drugs that are going to long-term cause serious health side effects. So buprenorphine has the positive of it can allow you to re-enter society and have a regular life. And it also has the positive of that it makes your health risk from taking opioids much lower. And for many people, because of their addiction, not taking opioids is it's not really an option for them. I'm told, the research has indicated that only 1 in 100 people really has a true addictive problem with opioids. Many of us do not have that problem. It's difficult to say that, oh, they should just stop these medications, because it's been found that for some people, just stopping is not an option. They don't have that level of control. So those are the advantages of buprenorphine. Thank you.